This person said their vet had mentioned hip dysplasia. What signs should they be looking for, and when do you typically recommend surgery?
So, hip dysplasia is a congenital genetic disorder. It's there, since birth, and it can become a progressive problem. So there's different degrees that they can affect. It can affect your dog. Early staging, early viewing, early diagnosis can be very beneficial. Clients act surprised when they bring in their limping 9-month-old dog and they can't believe that its hips are a problem. But that's
Right.
typically, the earlier you can diagnose that, the more potential treatment options you have to save the joint. And so, I think early screening, it can be ideal, especially in our purebreds or breeds that are predisposed.
Would you suggest maybe screening earlier on like larger breed dogs versus smaller, or to be more aware of it, I guess, in larger breed dogs
Yes.
versus small breed dogs?
Yeah, 100%. And I think people are unaware that, they go, well, I spent this much money on getting my purebred dog. They
Right.
showed me that, they're AKC certified. The parents have been for generations great. What people need to understand is that hip dysplasia is what we call a polygenetic problem. There are multiple genes that code for that problem. So yes, you can have litters and litters of normal, healthy dogs that never exhibit signs of hip dysplasia, develop hip dysplasia, but the genes are hiding within that line. So eventually it can show itself.